So today we are going to be talking about the midbrain. I am called Dr.Turyagumanawe. I'm a medical doctor. I hold a master's degree in public health, and I am a specialist in areas of surgery and public health. So today's outline, we are going to have introduction. We are going to have the introduction, the external features of the midbrain, the internal features, and the clinical correlates. So on the introduction here, you can see this here is the midbrain that we will be focusing on today. It is forming the rostral part of the brainstem, and it is just about 2 centimeters long, and it is the mesencephalon derivative. The embryonic derivative is the mesencephalon, and it connects the pons down here to the cerebrum via the crus cerebri, as we shall see in the details. So it has a cavity in its midline, and this cavity is the cerebral aqueduct of Sylvius, which connects the third ventricle and the fourth ventricle over here, and it divides the midbrain into the posterior part and the anterior part, and as we can see here in the illustration. So focusing on the external features, at the ventral aspect, we are able to see 2 elongated tracts of nerve fibers, which are called crus cerebri, and they converge downwards. They come from the cerebrum above, and they converge downwards towards the pons, and they enter the pons. And you can see on the ventral aspect, you'll be able to see the anterior perforated substance, which is perforated by small blood vessels in the interpeduncular fossa, and the oculomotor nerve emerges on the medial side of each of the crura of the midbrain. So looking at the dorsal aspect, it is presenting 4 rounded elevations. They are called the colliculi. You have the superior colliculi and the inferior colliculi, and they are separated by a cruciform or a cross-like sulcus, and above it ends by giving the lodging of the pineal gland, and inferiorly it becomes the frenulum veli, and on each side of the frenulum veli you have the trochlear nerve emerging from that side. And when we turn and we look at the dorsal aspect, again, this is again illustrating the dorsal view of the midbrain. You can see bundles of gray matter arising from each of the colliculi. These are called branchi. So you have the superior branchi for the superior colliculi, and you have the inferior branchi for the inferior colliculi, and these terminate into the respective geniculate bodies, whereby the superior colliculus, the superior branchi terminates into the superior geniculate body containing optic nerve fibers, and the inferior one connects the inferior colliculus to the medial geniculate body, which really carries auditory fibers. So here is the mid-sagittal view of the midbrain, again showing the cerebral aqueduct here, and anteriorly you have the cerebral peduncle, and posteriorly you have the colliculi that have been talked about previously. Again, here you can see the cerebral peduncles converging inferiorly to enter the pons, and you can see the perforated substance that we talked about in the anterior view. So we will move on to the internal features of the midbrain. We'll look at the discussion of the internal features. Conventionally is done by drawing a line at the level of the cerebral aqueduct, dividing the midbrain into the posterior part, which is called tectum. This is the smaller part, and this one has the colliculi, and then the anterior part, which is having the cerebral peduncle mainly, and the peduncle has the tegmentum, the substantia nigra, the crus cerebri, and the interpeduncular fossa in between the peduncles. So we we will now look at the structures on the inside part of the midbrain, and we note that they vary at different levels of the midbrain. They vary at the level of the superior colliculi and at the level of the inferior colliculus. But the crus cerebri and the substantia nigra, they are not varied across the entire length of the midbrain. So again, these are structures of the internal surface of the midbrain when you cut the midbrain at the level of the inferior colliculus. So we will focus on the gray matter of the midbrain. We will look at two important nuclei: the nucleus of the trochlear nerve over here, and the mesencephalic nucleus over here, and the nucleus of the trigeminal nerve. So the nucleus of the trochlear nerve is located just behind the median, just behind the median longitudinal fasciculus, labeled M here in the diagram, and the fibers from the trochlear nerve, they move backwards. And decussate towards the fourth ventricle, and in the superior medullary velum, exiting in the posterior part of the midbrain. Actually, this is the only cranial nerve that decussates within the midbrain within the brainstem before exiting, and it is the only one which decussates and exits within from the midbrain. So the other nucleus is the nucleus of the inferior colliculus, which is over here. So we will now move on from the gray matter, and we will talk about the white matter at the level of the inferior colliculus. We have the decussation of the superior cerebellar peduncle over here, which is the most important feature in the lower part of the midbrain, and ventral to it is the reticulospinal tract, labeled R over here, and the tectospinal tract are ventral to the longitudinal to the medial longitudinal fasciculus, which is labeled M over here. Then you have the lemnisci, which are arranged in a curved manner here, and we have the lateral, the spinal, the trigeminal, and the medial lemnisci. So we also have other nuclei at the level of the inferior colliculus, such as the mesencephalic nucleus of the trigeminal nerve, which enters part of the central gray matter and receives proprioceptive impulses from the muscles of mastication, teeth, ocular, and facial muscles. We also have the inferior, the nucleus of the inferior colliculus over here, and the substantia nigra, which is between the tegmentum. This is the tegmentum part, and this is the cross cerebri. So in between, we have the substantia nigra, this dark substance over here. So at the level of the superior colliculus, the internal features at the level of the superior colliculus, we will again start with looking at the gray matter. And again, like we saw at the level of the inferior colliculus, there are two main nuclei. So the nucleus of the oculomotor nerve over here, and the nucleus of the oculomotor nerve, and the mesencephalic nucleus in the same position at the level as it was. So we will look at the nucleus of the oculomotor nerve, which is this dark substance over here. And also we have to take note that the mesencephalic nucleus is at the same level as it was in the inferior colliculus, as you can see over here. The oculomotor nucleus, in the ventral part, there are two from each side. They come together and they merge, as you can see here, and they form a single nucleus complex, and they are bordered laterally by the medial longitudinal bundle. So and moving on from the gray matter, we look at the white matter, and of important here is the decussation of the fibers of the decussation of the fibers of the tectospinal and tectobulbar tracts, which come from the superior colliculus. So you can see the decussation, the decussation of the tegmental fibers over here, and you can see the ventral tegmental decussation over here, and there are other nuclei that we'll also pay attention to. These are most important: the Eddinghaus nucleus, which supplies the ciliary muscles, and sphincter papilla, which is part of the oculomotor nucleus. The oculomotor nerve passes ventrally. You can see the oculomotor nerve here passing ventrally through the tegmentum, and it enters. It goes through the tegmentum, the red nucleus, and the medial part of the substantia nigra over here, and emerges in the interpeduncular fossa over here. So the red nucleus, this pinkish substance here, is a mass of gray matter that is ovoid in cross section, and the superior colliculus is a flattened mass of gray and white matter, and then the pretectal nucleus over here is the nucleus which receives afferent fibers from the optic tract and passes them to Eddinghaus nucleus. So this nucleus is very important because it forms the pathway for the papillary light reflex and consensual light reflex, and lesion in this nucleus causes the famous Ajay-Robertson pupil, in which light reflex is lost but accommodation reflex is maintained. So we will have a summary of the structural components and what they do in the midbrain. So we will first look at gray matter, and then we'll look at white matter. So in the gray matter, you have the superior colliculus, which is the reflex center for visual reflexes, and the inferior colliculus, which is a reflex center for the auditory stimuli and the lower auditory center. And then you have the red nucleus, which is responsible for involuntary control of muscle tone and pressure. You have the substantia nigra, which is involved in regulation of activities of the basal nuclei, and mainly this is to do with movement. And you have the nuclei of oculomotor and trochlear nerve, which give rise to the motor fibers for extrinsic muscles of the eye. Then you also have the mesencephalic nucleus of the trigeminal nerve, which is responsible for proprioception of the face muscles of mastication, tooth, facial expression, and so on. So looking at the white matter, mainly it is the cerebral pedangles, which contain several ascending and descending tracts that are beyond the scope of this presentation, and it provides passages for these motor and sensory tracts. So we will go on and look at the blood supply of the midbrain. Mainly it receives, it has two blood supply. It has the basilar artery through the posterior cerebral artery over here. This is the posterior cerebral artery, and the choroidal and the anterior choroid arteries, and also the superior cerebral arteries, which is illustrated over here. So it also gives direct branches which supply the midbrain, and the venous drainage is to the basal and the great cerebral veins. So we will look at the clinical correlates. The one will start by looking at the Parkinson's disease, which occurs because of the destruction of the substantia nigra and leading to the deficiency of dopamine. So in this illustration over here, you can see the normal neuron in the substantia nigra discharging dopamine and being responsible for normal movement. And over here, there is no there is a deficiency of dopamine, and this leads to Parkinson's disease, characterized by intentional tremors, slow movement, cogwheel rigidity, and so on, because there is a destruction of the substantia nigra. The other correlate, we will talk about lesion in the superior colliculus leading to inability to track moving objects in contralateral field of vision and relative neglect of visual stimuli, although the eye movements are normal due to are maintained normally. The other problem we will look at is the Weber's syndrome. Weber's syndrome occurs when there is a vascular lesion in the basal region of the cerebral peduncle, and it is characterized by ipsilateral squint because of the involvement of cranial nerve number 3, contralateral hemiplegia because of the involvement of the corticospinal tract, contralateral paralysis of the lower part of the face and tongue because of the involvement of the corticobulbar tract, and you have ptosis because of involvement of the oculomotor nerve, and you will have ipsilateral fixed and dilated pupil, the so-called when there is a problem with the Edinger-Westphal nucleus, and you have parasympathetic and the parasympathetic component of the oculomotor nerve is involved. So on this image, this is the area that is involved in Weber's syndrome. So we will talk about another syndrome, another midbrain syndrome called Benedict's syndrome, and this is the area here which is involved in Benedict's syndrome, and it occurs when there is a vascular lesion or vascular ischemia in the tegmentum over here, and and it is involving the medial lemniscus, the spinal lemniscus, the red nucleus over here, and the superior cerebral peduncle and fibers of the oculomotor nerve as they pass through the red nucleus over here. So you can see the fibers of the oculomotor nerve passing over here. So this will result in ipsilateral squint and ptosis because of involvement of the oculomotor nerve, and you have contralateral loss of pain and temperature cessation due to involvement of the trigeminal nerve and the spinal lemnisci. You have contralateral loss of tactile muscle and joint and vibration sense due to involvement of the medial lemniscus, and you have contralateral tremors and involuntary movements because of involvement of the red nucleus and the substantia nigra. So the other phenomena that we will look at is the Perinaud syndrome. This is the area that is involved in the Perinaud syndrome, and it occurs when there is compression of the superior colliculus by tumors in the pineal gland, and it is characterized by loss of upward gaze without affecting the other eye movements. So those were just a few of the clinical correlates. There are other several clinical correlates, but these are the most common and most important ones. So so this was all about the lecture on the midbrain, external features, internal features, and the clinical correlates. I thank you for listening to me, and I hope we have been able to learn something.